Why? Because it affects the thyroid, and thyroid releases hormones, which affects the endocrine system. So, how do we know if we're going to have a thyroid problem, or how do we know if we have to do it is to test and do the proper lab testing, right? TSH, total T4, total T3, TPO, and TGB antibodies. However, if you're just curious about, do I, possibly have Hashimoto's, then you can start to look at your symptoms. What symptoms do I have that might suggest that I have Hashimoto's thyroiditis? Well, behind me is a list, okay? So let's go over that. Number one, dry hair or dry scalp. The reason that is because the thyroid hormone affects every cell in our body. It basically slows everything down. So if you have dry hair, dry scalp, or brittle hair, then you have to suggest, there's a possible correlation to hypothyroid or underfunctioning thyroid, okay? Next is loss of eyebrow, particularly the lateral 1/3 of your eyebrow. So if you have this sharp, dark eyebrow and then all of a sudden it just kind of disappears, you're losing the outside of your eyebrows, then you might have hypothyroid or Hashimoto's thyroiditis. Puffy face. Your face looks puffy, looks swollen, right? Yet your weight doesn't indicate that, but your face is always swollen. It's almost like you had so much salt before bed, and then you wake up the next morning and feel puffy. That's what Hashimoto patients look like all the time. Another one is enlarged thyroid. So the thyroid sits at the base of the neck and it kind of spreads out. And when you go like this, you're going to see a puffiness to the thyroid. And when you have active autoimmune disease or active Hashimoto's thyroiditis, it can actually be pretty tender to touch, okay? Next is slow heart rate, right? Your heart rate slows down to the point where, you might not be an athlete, but your heart rate is below, 60, right? Next is arthritis. So arthritic conditions can be cold intolerance. So you have cold hands and feet. The tip of your nose can be very cold, right? Or everyone is kind of wearing shorts and t-shirt and you need a sweater. You have cold intolerance, okay? Another one is depression. So depression is interesting is because there are so many people on psychotropic drugs and antidepressants. Yet, there's a correlation to Hashimoto's thyroiditis when you have depression. So if you are on any type of SSRIs or any other medications that control mood, I think it's important to rule out Hashimoto's thyroiditis and make sure you do not have that thyroid condition. Another is dry skin as well as dry scalp, right? Fatigue. Obviously, fatigue is a big factor with Hashimoto's thyroiditis or hypothyroid because thyroid hormones control your metabolic rate and everything kind of slows down. Therefore, fatigue will set in. Followed by poor memory, like your brain is not firing the way it should. It's constantly going, oh, what did I do? Or I forgot my keys, or did I turn off the stove? Did I close my garage door? All these things, the short-term memory issues. Another thing is menstrual disorders. So a lot of women have menstrual irregularities, but it could also be related to thyroid, okay? Infertility, right? Along with menstrual disorders comes infertility. So when women can't get pregnant for whatever reason, when you go to an infertility clinic, they check your thyroid hormones to make sure they're at normal levels. So it's important to understand that thyroid controls so many different metabolic factors, and you need to check for this. Another one is weight gain. So the classic example is, Dr. Sung, I am 20 pounds overweight or 30 pounds overweight. I exercise, I try to eat right, I eat like a bird, and I still can't lose weight, no matter what I do, right? So weight loss resistance is a big factor. As a matter of fact, when patients come in for weight loss, in our office, we check thyroid hormones to make sure those levels are normal and their inability to lose weight is not related to Hashimoto's. Another is constipation. So constipation is a pretty common sign that you have a slow system and having hypothyroid. But Hashimoto's thyroiditis can go up and down. It's kind of this kind of roller coaster ride. Sometimes you feel like you're excitable, you feel kind of sweaty, you can't calm down, and then next week you're tired, you're on the couch, you can't do anything. And you kind of have this up and down. So constipation might be a factor, but you can also have loose stool when you have in hyper state. So this up and down of Hashimoto's can create loose stool and constipation. Basically, it alternates. Brittle hair, brittle nails, dry skin, they're all related. Another one is morning headaches. So when you have headaches in the morning, you get up with a headache, and then it starts to clear out maybe 1 or 2 hours later, it's possible that you have a thyroid condition, okay? And another one right here is gallbladder problems. What does that mean? It means when you have fatty, greasy foods or heavy doses of protein, a big steak, you can't digest it very well. You get pain in that right upper quadrant and maybe radiating into the back or the shoulder, right? Or you just can't, digest foods well, and you can't absorb vitamin D, right? I find there are a lot of unnecessary gallbladder surgeries as a result of Hashimoto's thyroiditis. So gallbladder becomes very sluggish, it develops gallstones, and they take it out. It's surgically removed, right? But in reality, the underlying mechanism is an autoimmune condition that's affecting the sluggishness of the gallbladder. So it's important when you have all these symptoms, or some of these symptoms, to check if you have an autoimmune process. Because like I said, it is the #1 autoimmune disease, and it is the #1 endocrine disorder, right? So you need to check, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.